Yes, good morning to one and all beta. चलो बेटा टिके बेसी देह खराब होगला तो 10 जॉइन ही पारलेनी सो 45 मिनट्स लेट होगला सॉरी सो हमें 20 नंबर क्वेश्चन जे हम डिस्कशन करथिले राइट माइक्रोबायोलॉजी रो 20 क्वेश्चंस देखि सारथिले ठीक अछि ना गुड मॉर्निंग ओके हम डिस्कशन करबा जाओ कुछ भी हो जाए ठीक अपन वीडियो को लाइक कर दियो शेयर कर दियो तो फर्स्ट टाइम यदि चैनल को के देखुछ ताहले निहाती भाबरे चैनल को सब्सक्राइब कर दियो बेटा गुड मॉर्निंग ललिता महानंद गुड मॉर्निंग Thank you, Sunanda Singh, being a part of our NANDA Nursing Live members. ठीक क्वेश्चन नंबर 21 is which of the following field of applied microbiology deals with exploration for microbial life in outer space? ऑप्शन ए अच्छी पब्लिक हेल्थ माइक्रोबायोलॉजी, ऑप्शन बी अच्छी एयर माइक्रोबायोलॉजी, ऑप्शन सी अच्छी इंडस्ट्रियल माइक्रोबायोलॉजी एंड ऑप्शन डी अच्छी एक्सो माइक्रोबायोलॉजी. So which option is the correct answer beta? So correct answer is option D, right? Option D is the correct answer. Exomicrobiology, a field of applied microbiology, deals with exploration for microbial life in outer space, right? Option D is the correct answer. Next question देखो question number 22 रचिए what is an example of Monera microorganisms? Monera microorganisms. Monera refers to beta prokaryotic organisms, right? Monera it refers to beta kingdom of prokaryotic organisms. Kingdom of prokaryotic organisms. Prokaryotic organisms, right now. So what is an example of Monera microorganisms? Option is eubacteria, option is protozoan, option is invertebrates, option is mosses ferns. So correct answer कौन होगा बेटा? Correct answer is option A is the correct answer, right? Eubacteria. Eubacteria is also known as beta true bacteria. Eubacteria is also known as true bacteria. ठीक है जी ट्रू बैक्टीरिया यू बैक्टीरिया को अभी कौन कहूचे ट्रू बैक्टीरिया कहूचे राइट एंड दिस इज द मेजर ग्रुप्स विदिन द किंगडम ऑफ मोनेरा ठीक नेक्स्ट क्वेश्चन नंबर 23 रहे ईस्ट इच ऑप्शन है ईस्ट इच वायरस ऑप्शन है फंगस ऑप्शन है बैक्टीरिया ऑप्शन है एनिमल्स सो व्हिच ऑप्शन इज द करेक्ट आंसर ईस्ट इच वायरस फंगस बैक्टीरिया ऑप्शन is animals. So correct answer कौन होगा? Is each fungus, right? Is it a fungus? Correct answer कौन होगा? Fungus. Next question number 24 अच्छी how are gram-stain results differentiated between gram-positive bacteria and gram-negative bacteria? How are gram-stain results differentiated between gram-positive bacteria and gram-negative bacteria? Right? So option A अच्छी gram positive results are purple, gram negative results are pink. Option B अच्छी gram positive results are bluish black. Option B अच्छी gram positive results are bluish black, gram negative results are bluish green. Option C अच्छी gram positive results are bluish black, gram negative results are bluish black. Option D gram positive results are pink, Gram negatives results are purple. So which option is the correct answer? So correct answer is option A. Gram positive results are purple, gram negative results are pink, right? So option A is the correct answer, right? Very good. Bhavna Modi. Very good. Next question. Question number 25. Who introduced the staining technique? Who introduced the staining technique? Option A Louis Pasteur. Option A Paul Ehrlich. Option C Watson and Crick. Option D is Robert Koch. So correct answer is Robert Koch, right? Option D is the correct answer. So Robert Koch introduced the staining technique, right? Robert Koch introduced the staining technique. Right? Option D is the correct answer. Next question. Question number 26. What does acid fast staining do? What does acid fast staining do? Option which is differentiates between acid fast bacteria red and non-acid fast bacteria blue. Option B is cannot differentiate between non-acid fast bacteria red and acid fast bacteria blue. Option C is differentiate between non-acid fast bacteria red and acid fast bacteria blue. Option D is cannot differentiate between acid fast bacteria red and non-acid fast bacteria blue. So which option is the correct answer? So correct answer is option A. Right, beta. Option A is the correct answer. What does acid fast staining do? To differentiate between acid fast bacteria that is red and non-acid fast bacteria is blue. So option A is the correct answer, right? Next question, question number 27 is which of the following is an example of gram negative bacteria? Which of the example is an which of the following is an example of gram negative bacteria? Gram negative bacteria. Option is Staphylococcus, option B is Streptococcus, option C is Clostridium, option D is Salmonella. So which option is the correct answer? The correct answer is option D, Salmonella. Salmonella is the correct answer. Right? This is an example of gram negative bacteria. Right? ठीक ना? Next question. जो मैंने वीडियो देखो एवं वीडियो को लाइक करना बेटा फटाफट वीडियो को लाइक कर दिया. Next question, question number 28 is the cell wall deficient bacteria is. The cell wall deficient bacteria is option is mycoplasma, option B is Vibrio, option C is actinomycetes, option D is spirochetes. So which option is the correct answer? Correct answer is mycoplasma, right? Mycoplasma is a type of bacteria in which cell wall is not found. Cell wall is not found. And mycoplasm was discovered by किए बेटा कि discovered करथिले discovered by Knockard and Rocks in the year 1898. Knockard, N-O-C-A-R-D, Knockard and Rocks. Knockard and Rocks केबे करथिले in the year 1898. Right? Mycoplasm discovered by Knockard and Rocks in the year 1898. And this bacteria affects the various parts of our body. कौन को affect करछि बेटा? Lungs को, skin को, right ना? Next question, question number 29 is the organ of adhesion is. The organ of adhesion is option is flagella, option is fimbria, option C is nucleus, option is mitochondria. So which option is the correct answer, beta? The organ of adhesion is flagella, fimbria, nucleus, mitochondria. So correct answer कौन होगा बेटा? Fimbria होगा, fimbria. Fimbria are short hair-like structure, right ना? So correct answer is fimbria. Next question, question number 30 अच्छे spherical shaped bacteria are called option अच्छे bacilli, option अच्छे cocci, option अच्छे vibrio, option अच्छे spirilla. So correct answer कौन है बेटा? Correct answer is cocci, right ना? Spherical shaped bacteria are called cocci, right? Spherical shaped or round shaped ना? Next question, question number 31 is bacteria which derive their energy from sunlight is called. Option is chemotrophs, option is autotrophs, option is phototrophs, option is heterotrophs. So which option is the correct answer beta? Bacteria which derive their energy from sunlight is called chemotrophs, autotrophs, phototrophs, and option is heterotrophs. So correct answer is phototrophs beta, right? Phototrophs is the correct answer. Bacteria which derive their energy from sunlight is called phototrophs, right? Phototrophs are correct answer. Next question, there is a long whip-like structure that helps some single called organisms moves. Option A is flagella, option B is fimbria, option C is nucleus, option D is mitochondria. So which option is the correct answer? बेटा आंसर करो ना, आंसर करो मजा लगे भूल हो कौन अच्छी किसी असुविधा नहीं. Dash is a long whip-like structure that helps some single called organisms moves. Option is flagella, option is fimbria, option C is nucleus, option D is mitochondria. So which option is the correct answer? So correct answer is better flagella, right? Flagella is a long whip-like structure that helps some single-celled organisms. Flagella is a long whip-like structure that helps some single-celled organisms moves, right? So option A is the correct answer. Question number 33. Which is an example of gram-negative organisms? Which is an example of gram-negative organisms? Option is Listeria monocytogenes. Option B is Streptococcus pneumonia. Option C is Vibrio cholera. Option D is Staphylococcus aureus. So which option is the correct answer, beta? So correct answer is, which option is the correct answer? Correct answer is beta Vibrio cholera, right? Vibrio cholera. This is gram-negative organisms. Beta Vibrio cholera is gram-negative organisms, right? Next question, question number 34 is what is the place within which microorganisms can thrive and produce a portal of exit? Option B is a portal of entry, option C is pathogenicity, option D is a reservoir. So which option is the correct answer? Which option is the correct answer, beta? फटाफट आंसर कर लो, फटाफट आंसर करो. So correct answer is reservoir. Reservoir is the place within which microorganisms can thrive and reproduce, beta, right? Next question, question number 35. The term MRSA in bacteriology stand for, right? Option is methicillin reactive Staphylococcus aureus. Option B is multi-drug resistant Staphylococcus aureus. Option C is methicillin resistant Streptococcus anginosus. Option D is methicillin resistant Staphylococcus aureus. Right now. So which option is the correct answer, beta? बेटा मे भी आउथरे मे भी एक्सटेंशन ही पारे एबे जानि छ न गोटे रिसेंट न्यूज आइछि एफएम यूनिवर्सिटी रो किछटा कॉलेज रो 9टा कॉलेज रो एग्जामिनेशन हे नै ए पर्यंत फाइनल ईयर पिला मानकर तो मे भी से माने मंत्री को रिक्वेस्ट करछंती मे भी गोटे आउथर एक्सटेंशन हे पारे राइट तो हमको जति टाइम मिलबा हम सेति क्वेश्चन आंसर कवर अप करि परबा राइट तो सेही पई पाठ पढ़ा कंटिन्यू रख जोठी जा असुविधा होची किछि असुविधा नै हमको पढिबार अछि पोस्ट बाहर जे निहाती एग्जाम हबो राइट और निहाती हम पे जॉब रखा हिची किंतु हमको कोन करबार अछि पाठ पढिबार अछि एफएम यूनिवर्सिटी रे अंडर जेतिकी कॉलेज ऑफ नर्सिंग थिला नौटा कॉलेज ऑफ नर्सिंग रा स्टूडेंट माने एबे गतकाले से माने स्ट्राइक करछंती जानि छ ना सब कथा हला आउथरे में भी एक्सटेंशन हे पारे अंग्रे पर्यंत एग्जामिनेशन हे नै आई थिंक 7th 8th सेमेस्टर एग्जाम हे नै होते 6 7th 8 सेमेस्टर ठीक अछि तो तमे तमर पाठ कंटिन्यू करी रखिबार अछि अवहेला हबार नै राइट सो करेक्ट आंसर कोन हो बेटा करेक्ट आंसर इज ऑप्शन डी methicillin resistant staphylococcus aureus of correct answer MRSA in bacteriology stand for MRSA ର full form पछरिछि methicillin resistant staphylococcus aureus right तो इट कॉज बेटा स्टैफिलोकोकस इन्फेक्शंस और ये इन्फेक्शंस को बेटा ट्रीट करवाटा डिफिकल्ट है जे काहे कि ना it resistant to some antibiotic better right it resistant to some antibiotics so a staphylococcus infections को treat करवाटा ठीक मुश्किल difficult right so option D is the correct answer next question number 36 राशि antibiotic sensitivity is usually done on antibiotic sensitivity is usually done on ऑप्शन रहे ब्लड अगर ऑप्शन बी रहे मैक कॉन्की अगर ऑप्शन सी रहे म्यूलर हिंटन अगर ऑप्शन डी रहे चॉकलेट अगर सो व्हिच ऑप्शन इज द करेक्ट आंसर सो करेक्ट आंसर is म्यूलर हिंटन अगर म्यूलर हिंटन अगर is specifically designed for antibiotic sensitivity testing right बुझी पाला था बेटा ऑप्शन सी इज द करेक्ट आंसर राइट तो बेटा किसी टेंशन हवा नहीं से एफएम कॉलेज यूनिवर्सिटी रा पिला माने स्ट्राइक करंतु जहा करंतु हमको पाठ पढ़ा कंटिन्यू करबार अछि जानि तो हला इट्स समस्त गोटे इनफॉरमेशन समस्त जानी थी भी मीडिया न्यूज रे आसुची एबे और ने गत काली ठू मे भी एक्सटेंशन हे पारे द एक्सटेंशन हो जा हो हमको सितरे लेना देना नहीं सो व्हिच ऑफ द फॉलोइंग पायनियर्स दिस एक्सटेंशन हला बहुत गुडा स्टूडेंट गुडा बेनिफिट हेबे सेटा एक्चुअली गुड फॉर नर्सिंग प्रोफेशंस हम नर्सिंग फेड एस्पिरेंट मानक पय भलो सुखबरटा खुशी खबर समस्त पार्टिसिपेट करि पारिबा उचित हां ना बहुत गुडा वैकेंसी आसी काहे ना अपॉर्चुनिटी बार बार आसे नै हमको ये अपॉर्चुनिटी छाड़ हाथ छड़ा कर दिला असुविधा तो निहाती भाव से माने भी पार्टिसिपेट करबा उचित हां ना ताकर एग्जाम जल्दी हे कि समान रिजल्ट काढे कि समान रजिस्ट्रेशन आसी कि समान अप्लाई करि पारिबा उचित नाले किछि बहुत गुडा नर्सिंग स्टूडेंट्स गुडा का ये हेबे वंचित हो जिबे नै कि व्हिच ऑफ द फॉलोइंग pioneers of microbiology credited with the discovery of microorganisms using high quality magnifying lenses that is early microscopes option is Anthony van Leeuwenhoek option B is Louis Pasteur option C is Robert Hooke option D is Robert Koch so which option is the correct answer beta which option is the correct answer so correct answer is Anthony van Leeuwenhoek right he was the pioneers of microbiology right ना option A is the correct answer pioneers of microbiology किए Anthony van Leeuwenhoek and he is credited with the discovery of microorganisms using high quality magnifying lenses early microscopes that option A is the correct answer ठीक है बेटा. Next question, question number 38. The bacteria that retain the stain in Graham's method of staining is A. Option A is spores of bacteria. Option B is gram positive bacteria. Option C is gram negative bacteria. Option D is a broad spectrum bacteria. So which option is the correct answer? Correct answer is beta option B, gram positive bacteria. Right now, the bacteria that retains the stain in Graham's method staining is gram positive bacteria. Option B is the correct answer. Right. And it appears look like purple or violet. Right now, it appears look like purple or violet colors. Right. Next question, question number 39 is pseudo hyphae are seen in option is aspergillus, option is mucor, option C is candida, option is penicillin. So which option is the correct answer? Correct answer is better candida. Pseudo hyphae are seen in candida. Right. Next question, question number 40 is the genera that needs pyridoxal for growth is the genera that needs pyridoxal for growth is option is Aerococcus, option B is Enterococcus, option C is Pediococcus, option D is Granulicatella. So which option is the correct answer? Correct answer is beta Granulicatella is a genus of nutritionally variant streptococci that requires a pyridoxal or vitamin 6 for optimal growth in culture media, right? So correct answer is Granulicatella, right? So option D is the correct answer. Next question, would sequence देची बेटा correct order देची तक हमको identify करवाची. The correct order of the phases in the bacterial growth curve each option is a lag, exponential, decline, stationary. Option B is a lag, exponential, stationary, decline. Option C is a lag, decline, exponential, stationary. Option D is a lag, stationary, exponential, decline. So which option is the correct answer बेटा? एक क्वेश्चन आइथिला बेटा ESIC नर्सिंग ऑफिसर्स एग्जाम रे आइथिला. ESIC नर्सिंग ऑफिसर एग्जाम रे ए सीक्वेंस टा एक करेक्ट ऑर्डर्स टा पचारिथिला, राइट? तो करेक्ट आंसर इज ऑप्शन बी, लैग, exponential, stationary, decline, right? This is the correct order of the phases in the bacterial growth curve, right? Bacterial growth curve is lag, exponential, stationary, decline, right? Next question, question number 42 is nutritionally dependent bacteria are called as option is autotrophs, option is heterotrophs, option is phototrophs, option is chemotrophs. So which option is the correct answer? Correct answer is heterotrophs, right? Nutritionally dependent bacteria are called as heterotrophs. So they cannot produce their own food better, right? And must obtain nutrients by consuming other or organic matters, right? So this is the nutritionally dependent bacteria, heterotrophs, right? So they cannot produce their own food. They cannot produce their own food. So they are dependent bacteria beta. Cannot produce their own food. Right, next question, question number 43 is name the scientist who first observed and reported bacteria. Option A is Fracastorius, option which Antonio van Leeuwenhoek, option C is von Plancia, option D is Kircher. So which option is the correct answer? Kircher. Which option is the correct answer beta? Correct answer is Antonio van Leeuwenhoek. Option B is the correct answer. Option B is the correct answer, right? Now name the scientists who observe and reported bacteria. Ki kartile report first observe kartile and report kartile Anton van Leeuwenhoek. Right, next question, question number 44 is which of the following is the unit of measurement in bacteriology? Which of the following is the unit of measurement in bacteriology? Option is joule, option is Newton, option is micron, option is Pascal. So which option is the correct answer? Correct answer is micron, right? This is the unit of measurement in bacteriology. Joule कार unit beta? Joule is unit of energy, है ना? Joule is the unit of energy. This is Newton is the unit of force. This is the unit of force. And Pascal is the unit of pressure. Right though? Which of the following is the unit of measurement in bacteriology? So correct option कौन हवा? Micron हवा. Joule actually a unit of energy. Newton is the unit of force, and Pascal is the unit of pressure. So हमारा correct answer है जीवो option C, micron, right? Micron or micrometer को जे मने micrometer. Next question number 45 रचे. The division of bacterial cells and the exponential increase in their number are indicative of which phase? The division bacterial cells and the exponential increase in their number are indicative of which phase? Option A is stationary phase, option B is phase of decline, option C is lag phase, option D is logarithmic phase. So which option is the correct answer? Correct answer is logarithmic phase, also known as exponential phase. Logarithmic phase is also known as exponential phase. Exponential phase. So correct answer is option D beta, right? And this phase of bacterial growth, the division of bacterial cells and exponential increase in their number are indicative of which phase? Logarithmic phase, right? Or exponential phase. So option D is the correct answer. Next question number 46 rachi. In laboratory cultures, most human pathogens grow best at option A 30 to 37 degrees Celsius, option B 15 to 20 degrees Celsius, option C 30 to 50 degrees Celsius, option D 20 to 30 degrees Celsius. So correct answer is beta option A 30 to 37 degree Celsius, right? And this is the most suitable temperature for pathogen growth, human pathogens growth, right? Next question number 47, which is the organ of locomotion of bacteria. The organ of locomotion of bacteria, option is fimbria, option B is capsule, option C is spores, option D is flagella. So which option is the correct answer? Correct answer is beta option D, flagella. So the organ of locomotion of bacteria, that is flagella, right? Flagella के दिस बेटा hair like appearance, right? Hair like appearance. Next question number 48. Capacity of microbe to cause disease is known as. Capacity of microbe, most important MCQ beta. Capacity of a microbe to cause disease is known as, option is pathogenicity, option B is virulence, option C is infections, option D is immunity. So which option is the correct answer? फटाफट आंसर कर दलो. Which option is the correct answer? So correct answer is pathogenicity beta. Pathogenicity हवा correct answer, right? फटाफट आंसर करो, भूलो जाओ बेटा, हमको आंसर करवार अछि. Pathogenicity है ना? नहीं, pathogenicity is the correct answer. Capacity of microbes to cause disease is known as pathogenicity. Option A is the correct answer. Very good. Next question number 49 अछि. Endotoxins produced by gram-negative bacteria are usually, option A fatty acids, option B proteins, option C lecithin, option D lipopolysaccharides. So which option is the correct answer? Correct answer is beta option D, lipopolysaccharides. Endotoxins are a type of molecule found in the outer membrane of gram-negative bacteria, right? These all are found in outer membrane of gram-negative bacteria, right? Gram-negative bacteria. and the scientific term that is lipopolysaccharides beta. So correct answer is option D, right? Next question, question number 50 is all of the followings are toxins produced by staphylococcus. All of the followings are the toxins produced by staphylococcus except kahaku chhadiki. So correct answer kaun haba? Correct answer is option A leucocidin, option B hemolysins, option C enterotoxins, option D streptolysin. So correct answer kaun haba beta? Streptolysin. These all are beta toxin produced by staphylococcus, right? Leucocidin, hemolysin, enterotoxin. These all are the toxins produced by staphylococcus. कहाँ को छाड़े के? Streptolysin को छाड़े के, right? And this streptolysin toxins produced by which bacteria? Streptococcus bacteria, right? These all are produced by staphylococcus, and streptolysin is produced by streptococcus bacteria. Streptococcus bacteria. Streptococcus bacteria. Right? But leucidin, hemolysins, and enterotoxins produced by staphylococcus bacteria, right? Except streptolysin. So option D is the correct answer. Next question. Next question is beta. Which of the following factor does not affect microbial growth? Which of the following factor does not affect microbial growth? Option A is moisture, option B is nutrition, option C is darkness, option D is temperature. So which option is the correct answer? So correct answer is darkness. Option C is the correct answer. Right? Next question, question number 52 is which of the following disease is caused by bacteria? Which of the following disease is caused by bacteria? Option is dengue, option is AIDS, option is influenza, option is cholera. Dengue is a virus. Dengue is a virus. AIDS also virus. Co-virus. HIV wala. And dengue virus kaun beta? Den V1 and Den V2 is all are the virus. Influenza also a virus. Influenza also a virus. Who virus beta? HIV. HIV. So cholera is the correct answer, right? Cholera is the correct answer. So option D is the correct answer. Cholera is a acute diarrheal illness. और तार causative organisms किए बेटा? Vibrio cholera, right? Cholera रा causative organisms किए? Vibrio cholera. Vibrio cholera. And this is the bacteria, right? That's a bacterium or bacteria, right? Cholera disease is caused by bacteria. So option D is the correct answer. Very good. Next question, question number 53 is Clostridium tetani enters the body through option A is injections, option B is droplets, option C is open wound, option D is injections. So which option is the correct answer? Clostridium tetani. Clostridium tetani. Clostridium tetani enters the body through open wound. Option C is the correct answer, right? Open wound. Option C. Mamata saw very good. Option C is the correct answer, beta. Next question, question number 54. Which of the following viruses is primarily transmitted through the saliva of infected animals, typically via bites or scratches? Option is herpes virus, option is coronavirus, option is Lyssa virus, option is influenza virus. So which option is the correct answer? Correct answer is beta Lyssa virus, right? Lyssa virus. Lisa viral, yeah, virus like the rabies virus, right beta? Lisa virus like rabies virus. Rabies virus. And these are known to spread through spread through spread through spread through the saliva. Spread through the saliva of infected animals. Right now, it causing rabies when transmitted through bites or wound. Next question, question number 55 Raji. Which of the following substance in human breast milk inhibits growth of E. coli bacteria and protect the child from gastroenteritis? Option A casein, option B lactalbumin. Sorry beta. Option A casein, option B lactalbumin, option C Stewart factor, option D lactoferrin. So which option is the correct answer? Which option is the correct answer beta? So correct answer is lactoferrin, right? Lactoferrin is substance present in human breast milk, and that prevents the growth of E. coli bacteria and protects the child from gastroenteritis, right? नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 56 अच्छी बेटा जो मैंने वीडियो को लाइक करना ही पर्यंत वीडियो को लाइक कर दियो और शेयर कर दियो और जो मैंने फर्स्ट टाइम चैनल को देखो प्लीज सब्सक्राइब द चैनल एंड शेयर द वीडियो टू योर फ्रेंड्स, राइट ना? So invasion for a susceptible host by a pathogen or microorganisms resulting in a disease is termed as option A रचे immunity, option B cross infections, option C रचे colonizations, option D रचे infections. So which option is the correct answer beta? Invasion for a susceptible host by pathogen or microorganisms resulting in a disease is termed as immunity, cross infection, colonizations, or infections. So correct answer is beta infections, right? Infections. Infection is defined as invasion of a susceptible host by pathogen or microorganisms resulting in a disease causing agents. And their multiplications and the reaction of host tissue to these organisms, right? So correct answer kaun haba option D haba infections haba, right? Option D is the correct answer. Next question, question number 57 is the type of microscope in which there are difference in refractive indices between the bacterial cell and the surrounding medium each and dash microbes. Option रचे electron, option रचे dark ground, option C रचे phase contrast, option D रचे fluorescence. So which option is the correct answer beta? Correct answer is option C phase contrast, right? Phase contrast microscope, right? Phase contrast microscope enhance the contrast of transparent and color specimens by converting phase shift in a light passing through the specimen due to difference in refractive index into the changes in brightness, right now beta? So option C is the correct answer, right? Phase contrast of a correct answer, right? Next question, question number 58 is identify the most suitable descriptions of the infection chain of schistosomiasis. Identify the most suitable description of the infection chain of schistosomiasis. Option A men, snail, men. Option B mammal, arthropod, man. Option C bird, arthropod, man. Option D man, arthropod, man. So which option is the correct answer beta? Which option is the correct answer? The correct answer is option A, men, snail, man. Right, the transmission chain of Somiasis, schistosomiasis is most appropriately described as a human snail human. Right, this is the correct option beta. Human snail human or man snail man, right? This is the most suitable description of the chain of schistosomiasis, right? Option A is the correct answer beta. Question number 59 is an infectious disease such as hepatitis B and hepatitis C as a reservoir for pathogen is option which is the blood, option B is the urinary tract, option C is the respiratory tract, option D is the reproductive, option C is the respiratory tract, option D is the reproductive tract. So which option is the correct answer? Correct answer have beta blood, right? So infectious disease like hepatitis B and hepatitis C, which are blood-borne pathogen, है ना, blood-borne pathogen, blood-borne pathogen. So correct option A is the correct answer beta. When केतेबेले एटा होची बेटा, when we are contact with infected blood or body fluid, when we contacted with infected blood or body fluid, है ना, नहीं body fluids containing blood such as sharing needles, unprotected sexual contact, है ना, नहीं, or from mother to child during birth, from mother to child during birth, है ना, नहीं, sharing needles, unprotected sex, right, unprotected sexual contact. ये सब कारण जो बेटा कारण होची हेपाटाइटिस बी एंड हेपाटाइटिस सी होची, राइट? नेक्स्ट क्वेश्चन नंबर 60 मोस्ट इफेक्टिव मोड ऑफ ट्रांसमिशन ऑफ एचआईवी, मोस्ट इफेक्टिव मोड ऑफ ट्रांसमिशन ऑफ एचआईवी, मोस्ट इंपोर्टेंट एमसीक्यू बेटा मन रखिदा बेटा. आमे कोनसी सब्जेक्ट को स्किप करि पारिबानी, राइट ना, राइट, कोनसी सब्जेक्ट को स्किप करि पारिबानी. So every subject is important for us बेटा. माइक्रोबायोलॉजी फर्स्ट एड हो, माइक्रोबायोलॉजी हो कि साइकोलॉजी सोशियोलॉजी हो, प्रत्येक टी सब्जेक्ट इंपोर्टेंट फॉर आवर अपकमिंग OSSC नर्सिंग ऑफिसर एग्जाम. सर आम पास आउट ईयर केबे पकेबे 2025 ना 26 जेबे कि हम प्रोविजनल रे 2025 अछि बट रजिस्ट्रेशन 2024 बेटा. तुमर जेबे रिजल्ट पास आउट हेची, जेबे रिजल्ट पब्लिश हेची तेबे पकेबो बेटा. मोर भी सेमतिया मो भी एमएससी नर्सिंग करला बेले मोर भी लेट रे एग्जामिनेशन हला, लेट रे रिजल्ट बाहरला त मो लेट रे पकेली बेला, लेट रे पकेली माने जोट भी ऑनलाइन करछे मो माने जो वर्ष मो पास हेले से वर्ष रो से ईयर मु लिखुची हला. मे भी तमर सेशन सरी जइथिबो बेटा, सेशन सरी जइथिबो 2025 रे, हाँ ना नहीं, तमर सेशन 2025 रे सरी जइथिबो, बट जेहेतु 2026 रे तमर रिजल्ट पब्लिश हेचे, पासिंग ईयर लिखिबो बेटा 2026 का लिखिबो, पासिंग ईयर 2026, किछि असुविधा नै. हेलो 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 दीप्ति बुझी पालो ना बेटा 2026 रजिस्ट्रेशन में 2024 तमरो प्रोविजनल हेलो कुह कुआड़ी हाँ हाँ व्हाट्सएप कर दूँ क्लास करूँ तो व्हाट्सएप कर दूँ तुमको ठीक अच्छे तुम रजिस्ट्रेशन डेट जेबे मांगी थी मन रजिस्ट्रेशन जेबे है से डेटा पकेबा ना बेटा प्राइमरी रजिस्ट्रेशन जोटा है पासिंग ईयर जो वर्ष है से वर्ष पकेब सर्टिफिकेट जोटा अच्छी प्रोविजनल मन 2025 अच्छी 2025 प्रोविजनल सर्टिफिकेट रे और रजिस्ट्रेशन मन तुम 2026 रे करछ मतलब तुम पासिंग ईयर 2025 पकेब किंतु रजिस्ट्रेशन डेट जेबे करछ रजिस्ट्रेशन डेट से डेट रे पकेब उल्टा पुल्टा करबार नहीं बेटा अदरवाइज कौन हम एट द टाइम ऑफ डॉक्यूमेंट वेरिफिकेशन तुमको कौन कर दे रिजेक्ट कर दे ना डिस्क्वालीफाई तो नहीं रिजेक्ट कर दे तुमको हैला मागुची ना पासिंग ईयर बोले कि मागिबो हाँ ना नहीं पासिंग ईयर जो दीथिबो पासिंग ईयर रे जो वर्ष पास हिच से वर्ष रा डेट पकेबो माने डिसेंबर 2025 रे पास हिच डिसेंबर 2025 रे द रजिस्ट्रेशन डिटेल जेतुला आसीबो बेटा रजिस्ट्रेशन न पकेबो आरएनआरएम रा जेतुला आसीबो ला रजिस्ट्रेशन डिटेल्स जेतुला आसीबो से समय आरएनआरएम रो हमरो ओएनएमआरसी रा जो डेट थिबो से डेटा पकेबो केते तमरा एक्सपायरी केबे हबो सेटा पकेबो हैला से पे किछि टेंशन नबार नै आराम से उल्टा पुल्टा किछि करबोनी परफेक्टली सब दबार अछि भूल भाल करबोनी थोड़ी हमें डुप्लीकेट सर्टिफिकेट आनी के अप्लाई करके पाठ पढुछे ना कोन ना अप्लाई करछि ना चाकरी करछि बुझी परला तो so most effective mode of transmission of HIV sexual option B is blood product option C is needle syringe option D is mothers of fetus so most important MCQ beta is MCQ आसुची microbiology रू हैला so which option is the correct answer फटाफट आंसर कर दिलो most effective mode of transmission of HIV option is sexual option D is blood product option C is needle or syringe option D is mother of fetus so which option is the correct answer the most important mode for HIV or most common mode for HIV is sexual transmission right option A is the correct answer beta sexual transmission so option A करो बेटा and now blood product or blood product transmission is uncommon beta है ना sexual transmission this is the most common mode for HIV right option A का हबो बेटा right option B हबो नहीं option A is the common most common right option A is the correct answer beta sexual transmission hoche most important and most common mode for HIV right option A is the correct answer and this is uncommon beta right option A over right option A is the correct answer next question number 61 when the patient is acquiring infection from another patient it is known as when the patient is acquiring infection from another patient is known as most important MCQ option A cross infection option B iatrogenic infection option C is opportunistic infection option D is nosocomial infections already exam रे आसी सारे चाहिए सब questions right most important MCQ microbiology रो which option is the correct answer beta which option is the correct answer so correct answer अब one person to another person he कौन that is cross infections है ना vice versa that person to this person he भी cross infections so option A is the correct answer option A is the correct answer very good Lalita Mahanand Mamata Shaw Surya Narayan Pati very good beta next question number 62 रे अछि which of the following is a direct mode of transmission of infectious agent? Option is vehicle borne transmission, option is transplacental transmission, option is air borne transmission, option is vector borne transmission. So which option is the correct answer? फटाफट आंसर कर देलो. Which of the following is a direct mode of transmission of infectious agents? Which option is the correct answer, beta? So correct answer is beta option B only, right? From mother to her unborn child through the placenta, beta. So correct answer option B only, right? So this is the direct mode of transmission of infectious agent, and this transmission of infectious agent from a mother to her unborn child through the placenta, right? Through the placenta. So option B about correct answer, but option B only correct answer. Mamata Sao, Mona Lisa Satpathy, correct answer is option B. Very good. Next question, question number 63. Which antigen involved in hepatitis B transmission? Option A is surface antigen, option B is core antigen, option C is anti-hepatitis B antigen, option D is HBsAg. So which option is the correct answer, beta? Which option is the correct answer? So correct answer is HBsAg, right? HBsAg hepatitis B surface antigen. HBsAg रो फुल फॉर्म जानी चाहिए बेटा हेपाटाइटिस जो मैंने जानी ना लिख के रखो बेटा हेपाटाइटिस बी सरफेस एंटीजन जाने था हेपाटाइटिस बी सरफेस एंटीजन राइट HBsAg हवा करेक्ट आंसर. सो HBsAg antigen involved in hepatitis B transmission, right? Option D the correct answer. Next question, question number 64. An acid fast bacillus which is pathogenic. Option is Bacillus pertussis. Option which is Corynebacterium diphtheria. Option C is Mycobacterium leprae. Option D is Salmonella typhi. So which option is the correct answer? Correct answer is option C, beta. Acid fast bacillus which is pathogenic, Mycobacterium leprae. Acid fast bacillus Mycobacterium leprae have a correct answer, right? Next question, question number 65 rachi. Widal, a serological test is used to detect the presence of which of the following pathogenic organisms? Widal test, it's a serological test, it's used to detect the presence of which of the following pathogenic organisms? Option is E. coli, option is Mycobacterium tuberculosis, option C is Haemophilus influenza, option D is Salmonella typhi. So which option is the correct answer? Salmonella typhi को हमें कौन करचे डिटेक्ट करছে बेटा विडाल टेस्ट है ना नहीं विडाल टेस्ट है साल्मोनेला टाइफी को हमें डिटेक्ट करছে एंड दिस इज द कॉजेटिव एजेंट ऑफ टाइफाइड फीवर राइट ना दिस इज द कॉजेटिव एजेंट ऑफ or causative microorganisms of typhoid fever. मने रखी था क्वेश्चन आउची बेटा टाइफॉइड फीवर. Fetal test is diagnostics. हाँ, very good सूर्य नारायण पति, very good. Typhoid fever, salmonella typhi fetal test माध्यम में डिटेक्ट करूची and typhoid fever रो positive organism कौन बेटा? Positive agents is salmonella typhi, है ना नहीं? Very good, झरना रानी दीप, very good. Question number 66 is the causative agent of Lyme disease is. The causative agent of Lyme disease is most important MCQ microbiology रो भी बहुत गुड़े क्वेश्चंस अस्ति जोड़ा एग्जाम रे आउसी. ऑप्शन ए रचे रिकेट्सिया प्रोवाजेकी, ऑप्शन बी रचे अल्फा वायरस, ऑप्शन सी रचे वोरेलिया बर्गो डरफेरी, ऑप्शन डी रचे ट्रापोनोसोमा ब्रूसेई गामियंस. So which option is the correct answer? बेटा चारटा ऑप्शन दीजिए, चारटा ऑप्शन रो करेक्ट आंसर कौन होगा? व्हिच ऑप्शन इज द करेक्ट आंसर? करेक्ट आंसर इज बोरेलिया बर्गडोरफेरी. बोरेलिया बर्गडोरफेरी इज द करेक्ट आंसर. दिस इज द causative एजेंट ऑफ लाइम डिजीज. बेटा लाइम डिजीज रा causative एजेंट की बोरेलिया बर्गडोरफेरी. Borrelia burgdorferi is the causative agent of Lyme disease, right? Lyme disease. Next question. Question number 67 is incubation period of Taniasis or tapeworm. Incubation period of Taniasis or tapeworm. Option is 5 to 6 weeks, option B is 10 to 12 weeks, option C is 2 to 3 weeks, option D is 1 to 3 weeks. So which option is the correct answer? Tapeworm रो incubation period कितने बेटा? Tapeworm incubation period of Taniasis or tapeworm infection generally range from कितने बेटा? 8 to 12 weeks. 8 to 12 weeks, right? Range is 8 to 12 weeks. Option कौन दीजिए बेटा? 5 to 6 weeks, 10 to 12 weeks. Option C is 2 to 3 weeks, option D is 1 to 3 weeks. So correct answer is option B. Option B is the correct answer, right? Next question, question number 68 is incubation period of tetanus. Most important MCQ. Incubation period of tetanus. Option A is average 10 days, option B is average 50 days, option C is average 25 days, option D is average 8 weeks. So which option is the correct answer? फटाफट आंसर कर दियो. So correct answer is average 10 days बेटा, average 10 days, right? Tetanus रा causative organisms कौन बेटा? Clostridium tetani. Causative organisms of tetanus. Causative organisms of tetanus की है Clostridium tetani, right ना? Clostridium tetani, right? So actually incubation period कहते 3 to 21 days, but average incubation period कहते बेटा 10 days. Option A is the correct answer, right? Next question, question number 69 अछि a disease that spread by vertical transmission is. Option A अछि hepatitis B, option B अछि diphtheria, option C अछि typhoid, option D अछि malaria. So which option is the correct answer? Correct answer is option A, hepatitis B, right? Hepatitis B is spread by vertical transmission. Option A is the correct answer. Next question, question number 70 रच बेटा, which of the following disease is capable of infecting others before onset? Which of the following disease is capable of infecting others before onset? Option is mumps, option is typhoid, option is tuberculosis, option D is malaria. So correct answer is mumps, right? Mumps is capable of infecting others before the onset of visible symptoms due to its incubation periods. केते बेटा यार incubation period केते incubation period उडा माने रखिबा को पड़िबो ठीक 12 to 15 days. 12 to 15 days. Incubation period of mumps is 12 to 15 days. Right now, next question number 71. The disseminations of microbial aerosols. The disseminations of microbial aerosol to a suitable portal of entry is the respiratory tract is called. Option is vector burn, option is vehicle burn, option C is air burn, option is water burn. So which option is the correct answer? So correct answer is beta airborne disease, right? Correct answer is airborne disease, right now. Like COVID-19 माने अछि ना COVID-19 को माने अछि ना भूली गलो. The airborne disease are those diseases which spread through air. That is airborne disease. COVID-19, common cold, influenza, mumps, measles, whooping cough, these all are the airborne disease beta. कौन COVID-19, common cold, influenza, mumps, आउ कौन कहले मु आउ कौन कहले बेटा measles, आउ कौन whooping coughs. These all are the comes under airborne disease. So airborne disease ra symptoms कौन हबो बेटा coughing, sneezing है ना नहीं sore throat जोटा मते सब होईची नहीं कि coughing, sneezing, sore throat, headache, fever, swelling in nose, throat and lungs. These are the symptoms of airborne disease. Right? कौन होची headache, fever, sneezing, coughing, sore throat, right? एटा मते होईची airborne disease. Common cold. Next question number 72. The disease known as plague was transmitted to humans by option is mosquito, option is rat fly, option is flies, option is bugs. Most important MCQ beta आसुची ये सब questions एला माने रखिबार अछि. The disease known as plague was transmitted to humans by which option is the correct answer? Mosquito, rat flies, bugs. So correct answer is beta rat flies, right? Option B is the correct answer. Spread by rat flies. Nahin? This disease known as plague was transmitted to human by rat flies. हाँ कि नहीं? यार causative organisms कौन बेटा plague रा causative organisms माने रखी देता causative organisms plague रा causative organisms कौन yes Yersinia like Yersinia pestis bacteria Yersinia pestis bacteria, right? So plague the infectious disease caused by Yersinia pestis bacteria, and this is a zoonotic bacteria. Yersinia pestis bacteria, this is a zoonotic bacteria, right? Next question number 73 is the reservoir of infection for Ascariasis is found only in option is dog, option B is pig, option C is man, option D is cattle. So which option is the correct answer beta? Which option is the correct answer, which option is the correct answer? Men habo. The reservoir of infection for ascariasis is found only in men, humans, or men, only in humans or men. And this parasite is seen in कोटी बेटा कोटी देखने को मिले intestine रे देखा जाए बेटा this parasite is in intestine रे देखने को मिले intestine रे right intestine रे देखने को मिले and this is the most common infections in helminth infections called helminth infections माने रखे तो helminth infections. This is common in human helminth infections, right? Next question, question number 74. Most important questions, beta, most important MCQ. Gas gangrene is associated with questions asuji beta. Gas gangrene is associated with option is Clostridium perfringens, option is Clostridium tetani, option C is Clostridium novae, option is Clostridium histolyticum. So which option is the correct answer? Correct answer is Clostridium perfringens. The correct answer is option A. Gas gangrene is associated with Clostridium perfringens. Next question, question number 75. The process of neutrophilic infiltrate in tissue and necrosis formation is known as option A is cellulitis, option B is bacteremia, option C is septicemia, and option D is abscess formations. So which option is the correct answer? Beta correct answer is the abscess formation, right? The process of neutrophilic infiltrate in tissue and necrosis formation is known as abscess formation. The most important MCQ beta, most important MCQ mane rakhita. The process of neutrophilic infiltrate in tissue and necrosis formation is known as abscess formations. Accumulation of neutrophils as a result of inflammation of tissue, it's called neutrophilic infiltrate in tissue and necrosis formation is known as abscess formation. Next question. Next question. Which of the following is an airborne disease? फटाफट आंसर कर लो, फटाफट आंसर कर दे बेटा. जो मैंने वीडियो को लाइक करना है प्लीज फटाफट लाइक कर दो एवं शेयर कर दियो जमते समझते जॉइन ही पारिबे, राइट ना. जो मैंने वीडियो को लाइक करना फटाफट लाइक कर दो, शेयर कर दो वीडियो को जमते समस्त पाखे पहुंची पारिबो. व्हिच ऑफ द फॉलोइंग इज एन एयरबोर्न डिजीज? ऑप्शन ए हेपाटाइटिस सी, ऑप्शन बी रे मीजल्स, ऑप्शन सी रे कॉलेरा, ऑप्शन डी रे टाइफॉइड. सो व्हिच ऑप्शन इज द करेक्ट आंसर? So correct answer is measles. Measles is a airborne disease. है ना? Measles and क्या? TB, tuberculosis. TB also a airborne disease. सेफ में pulmonary medicine की TB chest ward जब काम करूचे मास्क पिंधे की काम करने को पड़िबो. Without मास्क पिंधे की काम करले निहाती भावरे हमें इन्फेक्शन पाइबा, है ना? नहीं राइट ना. नेक्स्ट क्वेश्चन, द मोस्ट कॉमन हॉस्पिटल एक्वायर्ड इन्फेक्शन एटा आसी सारची बेटा ए क्वेश्चंस फिर भी मन रखिबा को पड़िबो, हला भूली गले हबो नै. द मोस्ट कॉमन हॉस्पिटल एक्वायर्ड इन्फेक्शन इज ऑप्शन ए अछि digestive system, option B is kidney, option C is bladder, option D is respiratory. So which option is the correct answer? HAI hospital acquired infections, it is respiratory tract infections. हाँ ना, respiratory tract infections, respiratory tract infections or pneumonia, हाँ ना नहीं. ओके बेटा समस्त को आम कौन केतेटा लगे दूसरी कि हॉस्पिटल कौन बेटा जहाँ दरकार ताको लगा हुए अननेसेसरीली मिनिमाइज करा जाए कैथेटराइजेशंस मन अच्छी ना जदि पढ़ी भलसे देख जहाँ दरकार बेसी बेसी दरकार थाए तांको आमे कैथेटराइज करछ कैथेटराइजेशन हेले ना हम यूटीआई बेटा कैथेटर एसोसिएटेड इन्फेक्शंस यूटीआई हम मोस्ट कॉमन हॉस्पिटल एक्वायर्ड इन्फेक्शंस बेटा रेस्पिरेटरी हम ना 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 तुम बुलवा जाइथिबो फिर भी पाई जबो बेटा तुम एडमिशन न होइथिले भी मन हॉस्पिटल जाइथिबो इसमें हॉस्पिटल बेसी जीवो नै आमे कोन बुलवा जाइथिले भी आमे रेस्पिरेटरी इन्फेक्शंस पाई जबा ना रेस्पिरेटरी ट्रैक्ट इन्फेक्शंस से पे देखिबा कोविड-19 रे समस्त लगौतिले जो मानकर देह असुस्थ न होतिला से माने भी लगैतिले आ जो मानकर शरीर असुस्थ थिला से माने भी मास्क पिन्हुतिले बेटा हाँ ना दिस इज द मोस्ट कॉमन हॉस्पिटल एक्वायर्ड इन्फेक्शंस हॉस्पिटल को गले यागिना यदि क्रस्ट वेंटिलेशन न थिबो प्रॉपर वेंटिलेशन न थिबो ताहले गुड डिपार्टमेंट क्लोज्ड डिपार्टमेंट काम करबो ना बेटा निहाती भाबरे रेस्पिरेटरी ट्रैक्ट इन्फेक्शंस हबो टीबी हबो बुझी पल्ला ना ये सब कॉमन हॉस्पिटल एक्वायर्ड इन्फेक्शंस पाउछंती हमर स्टाफ माने पाउछंती अन नहीं हमर देह खराब होचे ना बेटा पेशेंट को केयर करला समय रे बहुत गुडा इन्फेक्टेड पेशेंट सहित आमे डील करछे ना अन नहीं टिके जदि एपट सेपट हला शरीर ताले पटाक से आमे इन्फेक्शन पाउछे मेनली तो कॉमन होचे रेस्पिरेटरी ट्रैक्ट इन्फेक्शंस नेक्स्ट क्वेश्चन हला ना करेक्ट आंसर इज ऑप्शन डी Next question, question number 78. The period between exposure to infection and the appearance of first symptoms is called. Option is latent period, option B is incubation period, option C is window period, option D is exposure period. So which option is the correct answer beta? Most important MCQ eta आसीची बेटा ये सब questions आसुची हमें माइक्रोबायोलॉजी को भी अंडर एस्टिमेट करिवार नहीं राइट ना द पीरियड बिटवीन एक्सपोजर टू इन्फेक्शन एंड द अपीयरेंस ऑफ फर्स्ट सिम्पटम्स इज कॉल्ड ऑप्शन अछि latent period, option B अछि incubation period, option C अछि window period, option D अछि exposure period. So correct answer कौन बेटा incubation period. The period between exposure to infection and the appearance of first symptoms is called what? Incubation period, right? Latent period कौन बेटा? The period between exposure and the onset of the period, right? It may be shorter or longer than incubation period, right? That is latent period. ठीक ना? And window period कौन between person become infected with a disease. Between a person become infected with a disease, right now? Then exposure period कौन बेटा exposure period the total length of like the total length of or total duration of total length of time an individual or a person's an individual or object is in contact with a specific agent that is exposure period, right? So correct answer is option B. The period between exposure to infection and the appearance of first symptoms is called incubation period, right now beta? Option B is the correct answer. Next question, question number 79 अछि considering the chain of infections a reservoir might be option A is tick carrying Lyme disease, option B is staphylococcus bacteria, option C is a contaminated water supply, option D is an uninfected patients. So which option is the correct answer? Correct answer is a contaminated water supply. Considering the chain of infection, reservoir might be a contaminated water supply. कंटामिनेटेड वाटर सप्लाई जो कौन भी हुए बेटा कोलेरा हुए ना कोलेरा बैक्टीरिया द्वारा भी हुए कोलेरा बैक्टीरिया आउ कौन बेटा right option C is the correct answer. Question number 80 is the most commonly used method to prevent the transmission of microorganisms from one person to another in hospital settings each. The most common used method to prevent transmission of microorganisms from one person to another in hospital setting each. Most important MCQ beta is सब questions पचारियो OSSC. Changing the bed linen daily. Option B is disinfecting instrument in special solutions. Option C is filtering air in hospital. Option D is washing hand thoroughly and frequently before or after checking the patients. तो फटाफट आंसर कर लो फटाफट आंसर कुनी ऑप्शन डी सुमन मिंज ऑप्शन डी सूर्य नारायण पति ऑप्शन डी वेरी गुड ऑप्शन डी ओनली करेक्ट आंसर बेटा ऑप्शन डी इज द correct answer. Very good. Next question number 81 is which of the following is a vector of infections? Option A an infectious fly. Option B a contaminated thermometer. Option C a contaminated ball. Option D an infected person. So which option is the correct answer beta? Which option is the correct answer? So correct answer is option A beta, an infectious fly, right? The infectious fly is a vector of infections, right? Option A is the correct answer. Next question number 82 is the stage of infection in correct sequential order are option A is the prodromal, incubation, illness and convalescence. Option B is the incubation, prodromal, illness and convalescence stages. Option C is the prodromal, primary infection, secondary infection and tertiary infection. Option D is the inflammation, infections and disease. कौन होगा आंसर फटाफट टिके कहलो हमें एबे पढुतले पर इंक्यूबेशन स्टेज कौन बेटा इंक्यूबेशन स्टेज और इंक्यूबेशन पीरियड द टाइम बिटवीन एक्सपोजर to a pathogen and the onset of symptoms, that is incubation stage, right na, that is incubation stage, right? Then prodromal कौन बेटा prodromal, the period after incubation, that is prodromal stage. The period after incubation, that is prodromal stage, right? Then illness कौन बेटा, the period when the disease is most acute and symptoms are prominent, that is illness, है ना. And convalescence stage कौन बेटा, recovery period after the illness, recovery period after the illness, that is convalescence, recovery period after the illness, right? So कौन होगा correct answer बेटा, correct answer is option B. Very good. Option B is the correct answer. Stages of infection in correct sequential order are incubation, prodromal, illness, convalescence stages. So option B is the correct answer, right na? Very good. बहुत बढ़िया. Next question number 83. The most common causative agent of rheumatic fever is most important MCQ बेटा microbiology रा most important MCQ. Causative agents of rheumatic fever बहुत गुड़ा हम causative agents causative organisms कही सारी से सब तुम मान को मॉडर्न रखिबार अछि. So this is also another most common causative agent of rheumatic fever is option A Streptococcus pyogenes, option B is Actinomyces viscosus, option C is Listeria monocytogenes, option D is Mycobacterium kansasi. So which option is the correct answer beta? So correct answer is option A, right? Correct answer is option A. Very good. The most common causative agent of rheumatic fever is Streptococcus pyogenes, right? ठीक है. Next question number 84 is measles is caused by option A is Nipah virus, ऑप्शन बी रूबियोला भाइरस, ऑप्शन सी हेंड्रा भाइरस, ऑप्शन डी न्यूमो भाइरस। बहुत इंपोर्टेंट एमसीक्यू बेटा मन रखी था। measles is caused by which virus? फटाफट आंसर करो। रूबियोला वायरस है ना, नहीं, ऑप्शन बी इज द करेक्ट आंसर। रूबियोला वायरस, measles is caused by रूबियोला वायरस, ठीक ना? ठीक, वेरी गुड। नेक्स्ट क्वेश्चन, हॉस्पिटल एक्वायर्ड इन्फेक्शन इज कॉल्ड, ऑप्शन ए कम्युनिकेबल डिजीज, ऑप्शन बी रहे वुंड इन्फेक्शन, ऑप्शन सी रहे ड्रॉपलेट इन्फेक्शन, ऑप्शन डी नोजोकोमियल इन्फेक्शंस। व्हिच ऑप्शन इज द करेक्ट आंसर बेटा? मोस्ट इंपोर्टेंट एमसीक्यू, आंसर कर दो फटाफट। ऑप्शन डी, वेरी गुड, ऑप्शन डी सूर्य नारायण पति, ऑप्शन डी चित्रा सोरेन, very good बेटा, ऑप्शन डी is the correct answer। nosocomial infections are the infections that develop during a hospital stay or in other healthcare settings, right? So option D is the correct answer। hospital acquired infection is called, it's known as, or is called nosocomial infections, right? Next question, question number 86 रही, out of the following what can be possible source of infections for brucellosis? out of the following what can be possible source of infection for brucellosis? option is rats, option which is sheep, option is goats, option which is horse। so correct answer is beta option C। brucellosis is a bacterial infection caused by brucella species, है ना? so goats are possible source of infection for brucellosis beta, so correct answer is option C। next question, question number 87 achi beta, infection that occurs as a result of therapeutic or diagnostic procedure is called ARN। option is opportunistic infections, option B is iatrogenic infection, option C is cross infection, option D is nosocomial infection। most important MCQ beta फटाफट आंसर कर दो। 5-star questions, most important, most very important beta questions। infection that occurs as a result of therapeutic or diagnostic procedure is called ARN। already asked such questions, so correct answer is iatrogenic infections beta, option B is the correct answer। very good Suman Minj, option B is the correct answer। iatrogenic infections केमती हुए बेटा? मेडिकल ट्रीटमेंट और डायग्नोस्टिक प्रोसीजर जो ही था ये इन्फेक्शन से पे हमको एसेप्टिक टेक्निक्स यूज करके प्रोसीजर करने को पड़े, है ना? नहीं, और डायग्नोस्टिक प्रोसीजर और थेरापेटिक ट्रीटमेंट जब चलते थे हमको एसेप्टिक टेक्निक यूज करके काम करवार चाहिए, ता द्वारा हम इन्फेक्शन को कंट्रोल कर पारे, राइट ना? सो ऑप्शन बी इज द करेक्ट आंसर बेटा। नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 88 है, ऑल ऑफ द फॉलोइंग आर टेपवर्म इन्फेक्शंस एक्सेप्ट, ऑप्शन ए रहे एकिनोकोकोसिस, ऑप्शन बी रहे ड्रैकुनोकुलियासिस, ऑप्शन सी रहे हाइमेनोलेपियासिस, ऑप्शन डी रहे कोइनोरोसिस। सो व्हिच ऑप्शन इज द करेक्ट आंसर बेटा? सो करेक्ट आंसर इज ऑप्शन बी बेटा, ड्रैकुनोकुलियासिस इज Guinea worm beta, this is a Guinea worm, comes under Guinea worm, right? it caused Dracunoculiasis beta caused Guinea worm, but all others are caused tapeworm, right? this is the tapeworm infection, echinococosis, hymenolipiosis, coinerosis, these all are the comes under tapeworm infections, right? and Dracunoculiasis is the Guinea worm, right? so accept this is ये तो से पे हमको Dracunoculiasis करने को पड़ेगा, right ना? फिर next question, question number 89 है, which of the following is not transmitted by Aedes mosquito? which of the following is not transmitted by Aedes mosquito? option is dengue, option is yellow fever, option is chikungunya, option is malaria। so which option is the correct answer बेटा? फटाफट आंसर करो, बिना भूल करके करेक्ट आंसर करो, फटाफट आंसर कर। नीतू प्रधान Option D, very good beta. Option D only correct answer, right? So dengue, yellow fever, chikungunya transmitted by Aedes mosquito. Transmitted by Aedes mosquito. Dengue, yellow fever, chikungunya, these all are transmitted by Aedes mosquito. है ना नहीं? अब मलेरिया किए ट्रांसमिट करुछि बेटा ट्रांसमिटेड बाय एनोफिलस मस्किटो मन रखिछ ना एनोफिलस मस्किटो एनोफिलस मस्किटो बट एडिस मस्किटो कौन करे बेटा डेंगू फीवर येलो फीवर चिकनगुनिया करछे राइट नेक्स्ट क्वेश्चन नंबर 90 which one of the following disease is not transmitted mainly by fecal oral route most important MCQ beta most important MCQ of microbiology which one of the following disease is not transmitted mainly by fecal oral route option is enteric fever option B is measles option C is cholera option D is hepatitis A so which option is the correct answer is measles right and measles transmitted through what beta droplet transmitted through this is the droplet infections right measles is the droplet infections केमती हबो बेटा coughing sneezing and not this is not contaminated through feces right this is not contaminated through feces but enteric fever cholera hepatitis A these all are the transmitted through fecal oral route है ना so option B is the correct answer beta next question number 91 which of the following is a digital platform for managing vaccination data and improving efficiency option A is Q win option B is D win option C is U win option D is K win so this option is the correct answer beta फटाफट आंसर कर देना so correct answer is U win beta right na universal immunization program by U win platform or digital registration करा जाए बेटा right this digital platform managing for vaccination data and improving efficiency so U win haba right next question number 92 रची in which of the following types of natural immunity is resistance to a particular pathogenic microorganisms shown by all the members of a species option A is passive immunity option B is species immunity option C is racial immunity option D is individual immunity so which option is the correct answer beta correct answer is option B species immunity is the natural resistance that all members of particular species possess against certain disease or pathogens right so this is a natural immunity species immunity is a natural immunity is resistance to a particular pathogenic of microorganisms right next question number 93 penta 5 vaccine is given on the second dose option A is 14 weeks option B is 20 weeks option D C is 18 weeks option D is 10 weeks so which option is the correct answer beta which option is the correct answer penta 5 pentavalent vaccine कहते हैं ना penta 5 vaccines और pentavalent vaccines right ना मन अच्छी बेटा मन रखिच ना भूली गल नर्सिंग कोर्स सरी गला भूली गल कौन से 5 serious disease बेटा what are that 5 serious disease diphtheria आउ कौन diphtheria pertussis tetanus आउ कौन hepatitis B आउ कौन बेटा hemophilus influenza type B HIV कहते hemophilus influenza type B hemophilus influenza influenza type B. These all are the pentavalent vaccines beta. So which option is the correct answer beta? So correct answer is option D, 10 weeks, right now. Penta 5 vaccine is given on the second dose, that is 10 weeks, right? Next question, question number 94. Which immunity leads to development of autoimmune disorder in an individual? Option is active immunity, option is passive immunity, option C is autoimmunity, option D is natural immunity. So which option is the correct answer? So correct answer is beta autoimmunity, right? Autoimmunity, where the immunity system attacks the body own tissue and leads to development of autoimmune disorder, right? Autoimmunity, our correct answer. Autoimmunity is the immune system attacks the body own tissue and it leads to the development of autoimmune disorder, right? Next question, question number 95. Which immunoglobulin crosses placenta and protects the newborn naturally against bacteria? Option A is IgM, option B is IgA, option C is IgG, option D is IgD. So which option is the correct answer beta? IgG crosses the placenta. Most important MCQ beta. Most important MCQ. The correct answer is option C, IgG, right? IgG crosses the placenta and naturally protects the newborn from bacteria. So option C is the correct answer. Giti Sri Buddha. Option C, very good beta. Surya Narayanpati. First dose 6 weeks, second dose 10 weeks, third dose 14 weeks. Right beta, you are right. Pentavalent vaccines ra. ठीक. So option C is the correct answer. IgG, beta most important MCQ ASI search questions mane rakhita. So IgG crosses the placenta and protects the newborn naturally against bacteria. Option C is the correct answer. Next question, question number 96 is humoral immunity is regulated by. Most important MCQ. Humoral immunity is regulated by. Humoral immunity is regulated by option A B lymphocytes, option A B lymphocytes, option B T lymphocytes, option C antigen presenting cells, option D cytokinase. Option A B lymphocytes, option A B lymphocytes, option B T lymphocytes, option C antigen presenting cell, option D cytokinase. So which option is the correct answer beta? Which option is the correct answer? The correct answer is option A. Option A, B lymphocyte is the humoral immunity, right? Humoral immunity is regulated by B lymphocytes. Very good, Surya Narayan Pratti. Very good beta. Next question, question number 97. In an individual human immunodeficiency virus infects cell in the immune system. An individual human immunodeficiency virus infects their cell in the immune system. Option A is monocytes, option B is mast cell, option C is T helper cells, option D is dendritic cells. So which option is the correct answer? So correct answer is T helper cells beta. Option C is the correct answer. T helper cells means CD4 cells. CD4 cells. Right now? Sorry. Sorry beta. In an individual human immunodeficiency virus infects dash cell in the immune system, that is CD4 cells or T helper cell. Option C is the correct answer. Next question. Good morning, Sonalika. Question number 98. Herd immunity protects the population by option A treating infected individuals, option B vaccinating children only, option C reducing the number of susceptible hosts, option D isolating infected persons. So which option is the correct answer? So correct answer is beta option C, reducing the number of susceptible hosts. Option C is the correct answer. Herd immunity protects the population by reducing the number of susceptible hosts, right? Through vaccination or prior injection. केमती करिबा हमें? Through vaccinations or prior injection. Through vaccinations, right ना? Next question, question number 99 is according to the national immunization schedule. According to the national immunization schedule, the first, second, and third doses of the pentavalent vaccines are administered at what ages respectively? एटा तमरा क्वेश्चंस आसी गला सूर्य नारायण पति तमरा क्वेश्चंस आसी गला ऑप्शन ए रही 8 to 4 and 6 weeks, ऑप्शन बी रही 8 6 10 and 14 months, ऑप्शन सी रही 8 6 10 and 14 weeks, ऑप्शन डी रही 8 2 4 and 6 months. तमरा फेवरेट एमसीक्यू सूर्य नारायण पति रो. So which option is the correct answer? Correct answer is option C. Already Surya Narayan Pati chat रे message करथिले, right ना. So pentavalent हमें केते बेले दोचे? First dose 6 and second dose 10 weeks and third dose 14 weeks रे दोचे ना respectively. 6 10 and 14 weeks रे दोचे pentavalent, right. Next question, question number 100. Route of Indian COVID vaccines बेटा केमती दिया है? फटाफट आंसर कर दो. IM, IV, intramuscular, intravenously, option C रही intradermally, option D subcutaneously. Route of Indian COVID vaccines कही देला कि केमती इंजेक्शन नहीं छ फटाफट आंसर कर दिया. ललिता महानंद आईएम नहीं चंती ओ ठीक अच्छे. सूर्य नारायण पति भी आईएम नहीं चंती सी वैक्सीन नहीं छना समझते समझते वैक्सीनेटेड ही छ आईएम रे देइथिले. हां ठीक अच्छे आईएम नहीं छना नाही रे कोविड वैक्सीन्स के नहीं छ के नहीं ना नहीं छ. हो आईएम नहीं कि आईएम तो ऑप्शन ए इज द करेक्ट आंसर. फुल फॉर्म ऑफ डीपीटी वैक्सीन्स फटाफट आंसर कर दो. सर आपण का हेल्थ भलो नहीं. यस यस भलो नहीं बेटा रात बहुत ज्वर हो गला मते फिर भी तुमको कथा देते जेहेतु से क्लास लाइव आसे पड़ला मते जाए जाओ बेटा जो होगा देखा जाएगा. फुल फॉर्म ऑफ डीपीटी वैक्सीन्स ऑप्शन रहे डिप्थेरिया पर्टुसिस टिटानस, ऑप्शन बी रहे पेलेग्रा डिप्थेरिया टिटानस, ऑप्शन सी रहे डिप्थेरिया टॉक्सिन पर्टुसिस, ऑप्शन डी रहे डेंटल टिटानस पर्टुसिस. सो व्हिच ऑप्शन इज द करेक्ट आंसर बेटा? सो करेक्ट आंसर इज ऑप्शन ए. समझते आंसर करो बेटा. फुल फॉर्म ऑफ डीपीटी वैक्सीन डिप्थेरिया पर्टुसिस टिटानस. हाँ कि नहीं? थैंक यू सूर्य नारायण पति. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 102 रही टोटल डोजेस रिक्वायर्ड ऑफ कोविशील्ड वैक्सीन इन हेल्थ केयर वर्कर्स. हाँ ठीक अच्छे. हाँ स्टीम नवा को पड़ो. ऑप्शन रही 1, ऑप्शन रही 2, ऑप्शन सी रही 3, ऑप्शन डी रही 4. सो व्हिच ऑप्शन इज द करेक्ट आंसर? ममता साहू 3, सोनालिका सी, निकी वर्ल्ड 3. सो बेटा ऑप्शन सी इज द करेक्ट आंसर. वेरी गुड. Option C is the correct answer. So total doses required of Covishield vaccine in healthcare worker, that is 3 doses, right now. हमको सब डोजेस दे देथिले बेटा. सब डोजेस हमको नवा पड़थिला. बूस्टर डोज, फर्स्ट डोज, सेकंड डोज, सब डोज हमको नवा पड़थिला. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 103 रही मोस्ट इंपोर्टेंट एमसीक्यू बेटा. माइक्रोबायोलॉजी रो नहीं कि मोस्ट इंपोर्टेंट एमसीक्यू. व्हाट डोज of vitamin A should be given in the booster dose at the age of 36 months? Option A रही 1 lakh unit, option B रही 1.5 lakhs unit, option C रही 2 lakhs unit, option D रही 2.5 lakhs unit. So which option is the correct answer? फटाफट आंसर करो बेटा। वेरी गुड, सबको पता है, इंपॉर्टेंट एमसीक्यू बेटा, पक्का से वही सब क्वेश्चंस। तो करेक्ट आंसर इज 2 लाख इंटरनेशनल यूनिट्स, है ना? 2 lakhs इंटरनेशनल यूनिट, IU 2 lakhs इंटरनेशनल यूनिट्स, है ना? नहीं, अकॉर्डिंग टू NPPB, अकॉर्डिंग टू NPPB, कौन है NPPB बेटा? नेशनल प्रोग्राम फॉर प्रिवेंशन ऑफ ब्लाइंडनेस, नेशनल प्रोग्राम फॉर prevention of blindness, prevention of blindness, right? And recommended booster dose is 2 lakhs units, right? Next question, question 104 is CDC recommends children get doses of MMR vaccines starting with the first dose at 12 through 15 months of ages, at the second dose at option A 4 to 6 years of age, option B 10 to 12 years of age, option C 2 to 3 years of age, option D 6 to 8 years of age. Most important MCQ सब बेटा, ये सब important, वैक्सीनेशन तो पक्का आसेबा MCQ, राइट? फर्स्ट डोज केबे नहीं होची बेटा? फर्स्ट डोज केबे नहीं होची? Between 12 to 15, between 12 to 15 months of age. In second dose between 4 to 6 years of age, right? Or before school entry, right? स्कूल को जीवा पूर्वर, है ना? वेरी गुड सूर्य नारायण पति, वेरी गुड बेटा। सो करेक्ट ऑप्शन कौन है बेटा? करेक्ट ऑप्शन, व्हिच ऑप्शन इज द करेक्ट आंसर? करेक्ट ऑप्शन इज ऑप्शन ए, ऑप्शन ए इज द correct answer, right? Now 4 to 6 years of age. Next question, question number 105 is dose of BCG vaccine is, dose of BCG vaccines, dose of BCG vaccines, Bacillus calmette-guerin, Bacillus calmette-guerin, BCG ର full form कौन? मने रख एवं मने पकाओ, Bacillus calmette-guerin, है ना? Bacillus calmette-guerin केमती दिया हुआ बेटा? BCG मने रखी था इंट्राडॉर्मली, मोस्ट इंपोर्टेंट MCQ इस बेटा, इंट्राडॉर्मली दिया हुआ, इंट्राडॉर्मली और ID, है ना? नहीं, इंट्राडॉर्मली दिया होची, को पटे दिया होची बेटा? लेफ्ट अपर आर्म रे दिया हुए, नहीं जनरली लेफ्ट अपर आर्म रे दिया हुए, माने अछि तो लेफ्ट अपर आर्म रे दिया होची। तो स्टैंडर्ड डोजेस कौन बेटा? स्टैंडर्ड डोजेस सो एट बर्थ टू 1 month of एज रे केते दिया हुए? 0.5 ml, राइट? 0.05 ml केते बेले दिया हुए बेटा? एट बर्थ टू 1 month of age, 1 month of age रे दिया होची, है ना? नहीं, then 0.1 ml के बेले दिया होची? 0.1 ml children older than 1 month to 1 year, children older than 1 1 month to 1 year of age, 1 year of age, right? ठीक है ना बेटा? So correct answer कौन है बेटा? The dose of BCG vaccine is option A is 0.5 ml, option B is 0.2 ml, option C is 0.1 ml, option D is 1.0 ml. So which option is the correct answer? So correct answer is option C. Option C is the correct answer. Very good. Lipin Maha good. Lalita Mahanand. Very good. Left side. Surya Narayan Pati. Sir, but birth is not mentioned. Okay. Next question. 106 is human sera given after dog bite to prevent rabies. Option A is passive immunizations, option B is toxoid, option C is active immunizations, option D is immunomodulation. So which option is the correct answer, beta? Which option is the correct answer? So correct answer is passive immunizations. Human sera given after dog bite to prevent rabies, passive immunizations. Human sera जानी ना बेटा? ह्यूमन सेरा ना जानी ना? HRIG कौन से HRIG बेटा? ह्यूमन रैबिज इम्यूनोग्लोबुलिन right are administered to dog bite patient है ना? नहीं, after dog bite to prevent rabies हमें दोचे human sera है ना? नहीं, so that is what? Passive immunization. This is a form of passive immunization, right? Right option is the correct answer. Next question, question number 107. Route of BCG vaccines. फटाफट आंसर करो, अभी डिस्कशन करते हैं, हम कही थे route of BCG vaccines. फटाफट आंसर करो बेटा, फटाफट आंसर करो. इंट्राडॉर्मल, सबक्यूटेनियस, इंट्रावेनस, ऑप्शन डी है इंट्रामस्कुलर. सो व्हिच ऑप्शन इज द करेक्ट आंसर? फटाफट आंसर कर दे. Very good. Option A is the correct answer. Route of BCG vaccine, that is intradermal. Right now, intradermal. Next question, question number 108. Route of administration of PPD. Route of administration. Purified protein derivative. Previous class में अगर AFD से discussion करते ले. Purified protein derivative. Purified protein derivative. हाँ ना? नहीं, Mantoux tuberculin test. Mantoux tuberculin test. Mantoux test माने अच्छी था बेटा, पढ़े थे ना क्लास से, पढ़े थे वो Mantoux test और tuberculin test है ना? नहीं, PPD for tuberculin test, purified protein derivative. Route of administration of PPD for tuberculin test केमती करा जाए? Yes, intradermal. Very good. Intradermal only. Intradermal है ना? नहीं, कितने दिया हुआ बेटा? कितने ml इंसर्शन करा जाए? कितने वॉल्यूम दिया हुआ? 0.1 ml. 0.1 ml दिया हुआ, राइट ना? हाइपरसेंसिटिविटी रिएक्शन टू टीबी एंटीजेंस को डिटेक्ट करवा पाए आमे पीपीडी पर ट्यूबरकुलिन टेस्ट करछे, राइट? डायग्नोस करवा पाए है ना? नहीं, ट्यूबरकुलोसिस को डायग्नोस करवा पाए बहुत गुडा टेस्ट करा हो है ना? नहीं, सीवी नेट, एएफवी, कफ टेस्ट, स्पुटम टेस्ट करा जाउछ ना? एटा गोटे ट्यूबरकुलिन टेस्ट. 8 mm diameter. Sure. Next question. Question number 109 is the only class of immunoglobulin which is transported across the placenta is option A IgG, option B IgA, option C IgD, option D IgM. So which option is the correct answer beta? Which option is the correct answer? बार बार पचरा होती क्वेश्चंस बार बार आसुची प्रत्येक टी एग्जाम रे हमको माने रखिबार अछि हैला हमको माने रखिबार अछि सो करेक्ट आंसर इज ऑप्शन ए IgG which is transport across the placenta. Very good. Next question, question number 110. The ideal storage temperature for a polio vaccine. Most important MCQ. Most important MCQ beta. The ideal storage temperature for a polio vaccine is option A rachi -5 degrees Celsius, option B rachi -20 degrees Celsius, option C rachi -15 degrees Celsius, option D rachi -10 degrees Celsius. So which option is the correct answer beta? Correct answer is B, -20 degrees Celsius. The ideal storage of temperature for polio vaccine is -20 degrees Celsius. पूरा मन रखी दे बेटा -20 degree Celsius. -20 degree Celsius. अदरवाइज तार पोटेंशियलिटी कमी जीव बुझी पाला ना एई जदी रिक्वायर्ड स्टोरेज टेम्परेचर हम जदी न रखिले ताहाले पोटेंशियलिटी नष्ट हो जीव हैला तो हमको -20 डिग्री सेल्सियस रे रखिबा को पडुची. नेक्स्ट क्वेश्चन क्वेश्चन नंबर 111. व्हाट इज द एटा समस्त खाई दिछो समस्त खाइछो ना नहीं ना एकटा बेले खाइबो एकटारे खाउछ समझते तो ना 12टा 12:30 रे खाउछ समझते खाई दीछ ना ना 1 बजे रे खाउछ ओके एकटारे खाउछ तो अदरवाइज हम क्लास स्टॉप करबो पुनी 4टा रे क्लास करबो ना बेटा. व्हाट इज द आइडियल टेम्परेचर फॉर स्टोरेज ऑफ डीपीटी वैक्सीन्स एटा भी मोस्ट इंपोर्टेंट एमसीक्यू हैला. What is the ideal temperature for storage of DPT vaccines? Option A is 2 degrees Celsius to 2 degrees Celsius to 8 degrees Celsius. Option B is at room temperature. Option C is 0 degrees Celsius to 2 degrees Celsius. Option D is 16 degrees Celsius to 22 degrees Celsius. So which option is the correct answer? So correct answer is which option? The correct answer is beta option A is the correct answer. Option A. Jyoti Manjari Jyoti. Option A is the correct. Very good. जो मैंने चैनल को सब्सक्राइब करना ना प्लीज सब्सक्राइब द चैनल एंड लाइक द वीडियो एंड शेयर द वीडियो बेटा प्लीज 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 इट्स माय रिक्वेस्ट टू वन एंड ऑल राइट ना. सो आइडियल टेम्परेचर कितने बेटा 2 डिग्री सेल्सियस टू 8 डिग्री सेल्सियस है ना नहीं. And do not freeze the vaccines. Do not freeze the vaccine. Do not freeze the vaccines. DPT vaccines को हमको freeze रखिबार नहीं freezing temperature रखिबार नहीं exposure भी करबार नहीं freezing temperature right. Next question. Which of the following COVID vaccine is an example of whole virion inactivated vaccines? Option A is Covaxin, option B is Covishield, option C is Sputnik, option D is Pfizer Biotech. So which option is the correct answer? Which option is the correct answer? Correct option is beta option A, Covaxin. Covaxin is the correct answer. Very good. Next question. Question number 113 is which of the following methods is used for administration of DPT vaccines? Option A is ventrogluteal, option B is vastus lateralis, option C is deltoid, option D is dorsogluteal. Important MCQ beta. Important MCQ. Which of the following methods is used for administration of DPT vaccines? Correct answer is option B. Very good, Sonalika. Lalita Mahanand. Very good. Vastus lateralis. Vastus lateralis muscle is used for the administration of DPT vaccines in infant and young children, right? In infant and young children. Option B is the correct answer. Very good, Surya Narayan Pati beta. Very good. Next question. Question number 114. Which of the following vaccines should kept in freezer compartment of refrigerator? Option is measles. Option B is DPT. Option C is hepatitis B. Option D is TT. So which option is the correct answer? Which option is the correct answer? Which option is the correct answer, beta? Which option is the correct answer? So option A is the correct answer. Chinda. Option A is the correct answer. Measles. Measles vaccines should kept in freezer compartment of refrigerators. DPT, hepatitis B, TT ये सब को हमें फ्रोजन कि रेफ्रिजरेटर रे रखिबानी बेटा, राइट ना? Next question number 116 is which in the most heat sensitive vaccine, most important MCQ, most heat sensitive vaccine, which one is the most heat sensitive vaccine beta? Most important, which in the most heat sensitive vaccines, which vaccine is most heat sensitive vaccine beta? Very good, oral polio vaccines. Option D is the correct answer, right na? Most freeze sensitive vaccines कौन बेटा? Most freeze sensitive vaccines. Most freeze sensitive vaccine की है बेटा? Most freeze sensitive vaccines is hepatitis B. Hepatitis B. Most heat sensitive vaccines है oral polio vaccines. Most freeze sensitive vaccines है hepatitis B. Right ना? मन रहिला. Next question number 117 अछि which of the following things can be placed in ILR? Which of the following things can be placed in ILR? Option is food and water. Option B is biological tissues. Option C is other drugs. Option D is unfrozen ice packs. Answer कर लो. So correct answer is biological tissue beta. Correct answer is biological tissue can be placed in ILR. है ना नहीं? ILR, ice-lined refrigerator. Ice-lined refrigerator. ILR जानी चाहता हो? Ice-lined refrigerator. हम वैक्सीन को स्टोर कर पाए रखो चे ना? This is designed for vaccines, storing vaccines. है ना नहीं? Next question number 118 अछि nasal COVID vaccine discovered by. Nasal COVID vaccine discovered by option A is Bharat Biotech, option B is Serum Institute of India, option C is National Institute of Virology, option D is AstraZeneca. So which option is the correct answer beta? Correct answer is Bharat Biotech. Correct answer is Bharat Biotech, right? Nasal COVID vaccine discovered by Bharat Biotech. Option A is the correct answer. Right? Next question number 119. Which of the following tests can be used to identify the potency of freezing vaccines? Option A is SEC test, option B is Havel test, option C is modified Havel test, option D is Mantoux test. So which option is the correct answer beta? So correct answer is SEC test. Option A is the correct answer. So SIC test can be used to identify the potency of freezing vaccines, right? Next question, question number 120. Which of the following vaccine firstly should be given soon after birth? Option A BCG, option B option A BCG, option B hepatitis B, option C OPV, option D diphtheria. फटाफट आंसर करो बेटा, ये सब क्वेश्चंस आसीबो, फटाफट आंसर करो. Vaccine firstly should given soon after birth. ना बेटा बीसीजी वैक्सीन होबो ना, ऑप्शन ए होबो ना, हेपेटाइटिस बी हो, कहेगा ना मदर कैन पास द हेपेटाइटिस बी वायरस टू द बेबी एट बर्थ ना, ये पे हमको हेपेटाइटिस बी वैक्सीन दवार अछि, फर्स्ट वैक्सीन हमें दवार अछि हेपेटाइटिस बी विदिन 24 आवर भीतर नहीं कि विदिन 24 आवर भीतर नहीं कि बेटा हमको हेपेटाइटिस बी वैक्सीन दवार अछि फर्स्ट, कहीं कि ना मदर कैन पास द हेपेटाइटिस बी वायरस टू द बेबीज, राइट ना. विदिन 24 आवर्स हमको हेपेटाइटिस बी वैक्सीनेशन करवार अछि. First vaccine that should be administered to the newborn baby within 24 hours, that is hepatitis B beta, right? Hepatitis B is the correct answer. Next question, question number 121 beta. HPV vaccine schedule in adults and girls is option A 3 doses in 0 to 6 month interval, option B 3 doses in 0-1-6 month interval, option C 3 doses in 0-6-12 month interval, option D 2 doses in 1-6 month interval. So which option is the correct answer? HPV vaccines. HPV vaccines. तो फर्स्ट डोज 0 मंथ्स रे दिया हुए बेटा, फर्स्ट डोज केते बेले दिया हुए 0 मंथ्स रे फर्स्ट डोज, एंड सेकेंड डोज 1 to 2 months रे दिया हुए बेटा, 1 to 2 months. Then third dose 6 months after second dose, 6 months after second dose, right? This is the 3 doses schedule for adolescent or 15 to 26 year old girl, adolescent girl, that is 15 to 26 year girls, so 3 dose schedule beta, right? So which option is the correct answer? Option D is the option D. Option D केमते? Oh, 9 to 4, sorry, it adolescents, sorry, adolescents girl ro ages केते बेटा? Adolescents means age केते कहला first? Adolescents माने मात्र दीटा डोजेस नेबे, एडोलसेंट गर्ल्स माने दीटा डोजेस नेबे, राइट? अब 15 ରୁ 26 वर्ष जो माने हेतु तीनटा डोज नेबे, 15 to 26 ईयर गर्ल्स माने तीनटा डोजेस नेबे हला, एंड एडोलसेंट्स माने 9 to 14 इयर्स से माने कोन करबे बेटा 0 months फर्स्ट डोज एंड सेकंड डोज इन 6 to 12 months, सेकंड डोज फर्स्ट, सेकंड डोज 6 to 12 months after first dose, after first dose, right? So correct answer कौन होगा? Option D है बेटा. Option D is the correct answer, right ना? For adults and girls 2 doses दरकार बेटा. Only 2 doses दरकार. Adults and girls in the age of 9 to 14 years ସେମାନେ कौन नेबे? First dose 0 months, second dose 6 to 12 months after first doses, right? It is the correct vaccination schedule for HPV. Next question. Question number 122 रची. In the childhood immunization nowadays in DPT vaccines, one vaccine is removed due to its occurrence of large number of side effects. It is option is tetanus, option B is diphtheria, option C is pertussis, option D is all of the above. So which option is the correct answer? Very good. Pertussis over beta. Pertussis is the correct answer. Just कतन चिंदा. C is the correct answer. Right now. तो यही वैक्सीनेशन कला पर कौन होचे? सीजर हुए पिलांको सीजर होची, राइट? सीजर होची, then high fever होची, बेसी कांदंती after this vaccinations, right? So this pertussis component को कौन कराए ची बेटा? रिमूव कराए ची in DPT. Right, option C is the correct answer. Next question, question number 123. Dash expose an individual to a weakened strain of a pathogen with the goal of establishing a subclinical infections that will activate the adaptive immunodefense. Option A is subunit vaccines, option B is live attenuated vaccines, option C is toxoid vaccines, option D is conjugate vaccines. So which option is the correct answer, beta? Correct answer is option B, a live attenuated vaccine. Dash expose an individual to weakened strain of pathogen with the goal of establishing subclinical infection that will activate the adaptive immune defense. Right? Live vaccine contains weakened form of live virus, right? Live attenuated is weakened form of virus, beta. Weakened form of live virus or bacterial. So option B is the correct answer, beta, right? And weakened form triggers a strong and lasting immune response. बुझी पाला ना? So correct answer कौन होगा? Live attenuated vaccines, beta. Next question, question number 124 है. Which of the following is a live attenuated vaccines? फटाफट आंसर कर दो. Live attenuated vaccines. रूबेला इचे लाइव एटेन्यूएटेड वैक्सीन बेटा. रूबेला, डिप्थेरिया, टिटेनस, हेपेटाइटिस. रूबेला इचे लाइव एटेन्यूएटेड वैक्सीन. रूबेला है ना? नहीं, measles, mumps, rubella, live attenuated vaccines. Measles, mumps, rubella, MMR, live attenuated vaccines. Live attenuated vaccines बेटा. Measles, mumps, rubella. Next question, question number 125. Which of the following is called internationally available cholera vaccine? Option A Dukoral, option B Daptacel, option C Vivotif, option D Menactra. Which option is the correct answer? The correct answer is beta option A Dukoral. Dukoral is an oral vaccine that provide protection against cholera. Dukoral is a oral vaccine that provide protection against cholera, right? and diphtherial is protection against beta for diphtheria, right? And Vivotip is the typhoid vaccines beta, typhoid vaccine, right? Typhoid vaccines. And Menactri hoche beta meningococcal vaccines, meningococcal vaccines, right? बेटा समझते खाई कि पळे आसो 4 PM रे हमें पुणी थरे क्लास करबो एति केबे क्लास आज कर सेशन को एति हम क्लोज करबा बेटा हैला समझते खाई पी कि आराम से 4टा बेले पुणी थरे क्लास करबा सोई पड़िबोनी और देह खराब हेले भी तुम मानकर क्लास नौ तुम मानकर बेनिफिट्स पे तुम मानकर केमती हेल्पफुल हम राइट ना सो 4 PM रे आउ थे सेकेंड सेशन हमर स्टार्ट हम 4 PM रे सेकेंड सेशन आरंभ हम तो समस्ते जॉइन हो बेटा आम माइक्रोबायोलॉजी रे किछि क्वेश्चंस देखुथिले राइट एबो 100 क्वेश्चंस हमें डिस्कशन करले बेटा मोस्ट इंपोर्टेंट MCQ गुडा हमें डिस्कशन करे चलछे राइट देन 4 PM रे अगेन हमें जॉइन हे जबो पुनी नेक्स्ट सेशन हमें संडे रो दीदीटा सेशन हमें करूचे सकाळ गोटे संध्या रे गोटे नै कि फ्री जॉइन हे जबो गोटे गोटे थरा हम क्लास करबा मे बी माइक्रोबायोलॉजी रो क्वेश्चन आंसर सॉरी गला पर हमें नर्सिंग फाउंडेशन स्टार्ट करबा बेटा अल्प किछटा क्वेश्चंस अछि माइक्रोबायोलॉजी रो सॉरी जीवो आपरे नर्सिंग फाउंडेशन रो इंपोर्टेंट MCQ हम डिस्कशन करबा ओके थैंक यू सो मच टू वन इन ऑल जो मैंने फर्स्ट टाइम चैनल को देखुछ चैनल को सब्सक्राइब कर दियो एवं वीडियो को लाइक करके शेयर मध्य कर दियो जंती समस्त को पाखरे पहुंची परबो निज निज संग मान को पाखरे पहुंची परबो वीडियो को लाइक कर दे शेयर कर दे एवं चैनल को फर्स्ट टाइम यदि देखुछ चैनल को सब्सक्राइब कर दे बेटा प्लीज इट्स माय हम्बल रिक्वेस्ट टू वन एंड ऑल थैंक यू ऑल वंस अगेन हमें देखा हबो 4 PM रे देखा हुआ आउथरे राइट से पर्यंत टेक केयर एंड बाय बाय एंड स्टे मोटिवेटेड बेटा एंड ऑलवेज पाठ पढ़ो बेटा राइट ना कुछ भी हो जाए जब तक तोड़ेंगे नहीं तब तक छोड़ेंगे नहीं जब तक हमारा नर्सिंग ऑफिसर एग्जाम रे क्वालिफाई करनु कि जे पर्यंत हमें जॉइन हे नहीं हमरो अपॉइंटमेंट लेटर आसेनी से पर्यंत हमको पाठ पढ़िया पड़ो है ना जे पर्यंत निजर ना रे अपॉइंटमेंट लेटर आसेनी से पर्यंत हमको पाठ पढ़िया पड़ो राइट सब बेला मोटिवेटेड रहबार छी सेल्फ मोटिवेटर हबार छी बेटा मो तो तमन को मोटिवेट करा पे पूरा अच्छी निजे भी मोटिवेट हिकरी पाठ पढ़ियार अछि मोर काम कोन मोर रिस्पांसिबिलिटी कोन से जानबार अछि राइट ना तो थैंक यू सो मच फॉर जॉइनिंग इन दिस लाइव सेशंस बेटा रहली बेटा बाय बाय टेक केयर।